This video presents a comprehensive exploration of the profound health changes that occur when sugar is removed from the diet for just 2 weeks. Dr. David Maxwell, a health expert and advocate for nutritional awareness, blends personal experience with scientific evidence to illuminate the dramatic improvements in physical and mental health brought about by this dietary shift. Visible changes in facial appearance. One of the most noticeable transformations is the change in facial features. Dr. Maxwell discusses how cutting sugar led to a leaner, more defined face. Previously, his face appeared round and puffy, a direct result of excess fat stored from a carbohydrate-heavy diet. When he reduced his weight from 154 pounds to 128 pounds, the physical difference was striking. The bloated appearance caused by sugar-induced water retention and inflammation gave way to a more toned and healthier look. This transformation is not only cosmetic, it reflects an underlying improvement in overall health. Reduction in abdominal fat. When sugar is removed from the diet, the body is forced to switch its energy source from glucose to stored fat. The human body naturally prioritizes sugar for energy when it's available, but in its absence, it begins to metabolize fat. This metabolic switch significantly reduces belly fat. The abdomen is a common area for fat accumulation, especially in those who consume high amounts of refined sugars and carbohydrates. By eliminating sugar, the body becomes more efficient at utilizing fat, leading to visible and measurable reductions in waist size. Enhanced vision health. Although Dr. Maxwell suffers from nearsightedness, which is not caused by sugar intake, he explains that excessive sugar can damage the delicate blood vessels in the eyes, particularly in individuals with diabetes. High blood sugar levels lead to inflammation and vascular damage, which can ultimately impair vision. By cutting sugar, individuals can prevent or slow this damage. The improvement may not be immediate or corrective for refractive issues, but it can protect long-term eye health, especially by reducing the risk of diabetic retinopathy. Improved kidney function. The kidneys are sensitive organs responsible for filtering waste and maintaining fluid balance. Excessive sugar consumption can lead to inflammation of the nephrons, the tiny filtering units within the kidneys. Over time, this inflammation impairs kidney function and may contribute to the development of chronic kidney disease. Sugar-induced damage is a major concern for those with diabetes, as the condition significantly increases the risk of kidney failure. According to Dr. Maxwell, stopping sugar intake can help mitigate this damage, though it may not reverse advanced kidney disease. Still, for many, it offers a chance at recovery and improved kidney performance. Healthier arteries and lower blood pressure. Sugar contributes to systemic inflammation, including within the cardiovascular system. This inflammation leads to atherosclerosis, or the hardening and narrowing of arteries, which in turn causes high blood pressure. Dr. Maxwell emphasizes that fat is often mistakenly blamed for cardiovascular problems, when in reality, sugar plays a much larger role. Eliminating sugar helps restore arterial flexibility, reducing vascular resistance and improving blood pressure levels. This not only lowers the risk of heart attack and stroke, but also enhances overall cardiovascular health. Better brain and nervous system function. The nervous system is especially vulnerable to damage from high blood sugar. Chronic sugar consumption can lead to neuropathies, such as numbness in the hands and feet, as well as contribute to neurological conditions like Parkinson's and Alzheimer's disease. Dr. Maxwell explains that reducing sugar improves nerve function, concentration, and memory. Many individuals report a brighter mood, greater mental clarity, and reduced brain fog within days of quitting sugar. These cognitive benefits are particularly important for aging individuals and those with metabolic syndrome. Decreased insulin resistance. One of the most critical advantages of eliminating sugar is the reduction of insulin resistance. Insulin resistance is a condition where cells in the body become less responsive to insulin, leading to elevated blood sugar levels and eventually type 2 diabetes. Dr. Maxwell argues that carbohydrates, especially refined ones like sugar, rice, and grains, are the real culprits behind this condition. not saturated fat or genetics. He supports this with real-life stories from his health community, where members with long-standing diabetes manage to stop their medication after removing sugar from their diets. This reversal indicates that the pancreas can recover and insulin sensitivity can be restored. Fewer nighttime bathroom visits. Frequent nighttime urination, known as nocturia, is often linked to high sugar intake. When sugar is filtered through the kidneys, it draws water with it, leading to increased urine production. This disrupts sleep and can lead to fatigue. Cutting sugar decreases this osmotic effect, resulting in fewer trips to the bathroom and better quality of sleep. Improved sleep supports overall well-being, mood, and hormonal balance. Stable energy levels. Dr. Maxwell compares the body's energy sources to batteries. Sugar is like a small battery, while fat is a large, long-lasting one. The body stores about 100,000 kilocalories of energy as fat, but only around 100 kilocalories as glycogen. When relying on sugar, people experience rapid energy highs and crashes. However, when the body adapts to burning fat, energy levels become more consistent and sustained. This prevents hypoglycemia-related symptoms such as dizziness, irritability, and fatigue. Decreased cravings and appetite. Once the body becomes efficient at burning stored fat between meals, the constant need for snacks diminishes. Dr. Maxwell points out that excessive snacking, driven by sugar highs and lows, contributes to many health problems. By stabilizing blood sugar and enhancing satiety, eliminating sugar helps individuals eat less frequently and develop a healthier relationship with food. This change also reduces emotional eating and mindless snacking, lowered inflammation and pain. Sugar is a major pro-inflammatory agent in the body. Chronic inflammation underlies many diseases, including arthritis, cardiovascular disease, and autoimmune conditions. Removing sugar from the diet can rapidly decrease inflammation in the blood vessels, kidneys, nervous system, and eyes. Dr. Maxwell shares that many people experience a reduction in joint pain and are able to discontinue medications for inflammation and high blood pressure after eliminating sugar. Long-term weight and fat loss. The initial weight loss seen after quitting sugar is often due to water loss. When glycogen stores are depleted, the water bound to them is also excreted, leading to a rapid loss of about 13 pounds in the first 1 to 2 weeks. However, the real transformation begins when the body starts burning fat reserves. This usually happens after about 36 hours of fasting or sugar abstention. By maintaining a sugar-free diet, the body continues to access these fat stores, leading to sustainable and long-term weight loss. Healthier, clearer skin. Skin health is another area that benefits greatly from cutting sugar. Systemic inflammation often manifests in the skin as acne, redness, and puffiness. As inflammation subsides, the skin becomes clearer and the face looks less swollen. Many people report a more even complexion and a visible reduction in conditions like dermatitis. These changes are not only cosmetic, but also indicative of improved internal health, metabolic improvements, and nutrient absorption. Dr. Maxwell reiterates that sugar reduction leads to a dramatic decrease in insulin resistance. He emphasizes that insulin resistance is the root of numerous metabolic disorders, including fatty liver, high cholesterol, cardiovascular disease, and even certain cancers. High sugar intake stimulates constant insulin production, eventually leading to pancreatic burnout. Improving insulin sensitivity also enhances the body's ability to absorb key nutrients, such as potassium, magnesium, vitamin B1, calcium, and vitamin D. These nutrients are essential for muscle development, fat metabolism, and maintaining a youthful appearance. Empowerment. To begin the journey, Dr. Maxwell encourages viewers to take immediate action rather than delay. He acknowledges that the first 2 or 3 days without sugar can be tough, often marked by withdrawal symptoms such as headaches, irritability, or fatigue. However, he emphasizes that these discomforts are short-lived and minor compared to the long-term benefits of preventing chronic illnesses. He strongly recommends joining a supportive community like Healthy Living for Longevity, where individuals can access meal plans, shared experiences, and ongoing encouragement. Final reflections in conclusion: the decision to cut sugar from the diet, even for just 2 weeks, can set in motion a series of profound health transformations. From physical changes in appearance to improvements in metabolic function, mental clarity, and emotional well-being, the benefits are far-reaching and well supported by science. Dr. Maxwell's insights, grounded in both personal experience and clinical knowledge, serve as a powerful reminder that dietary choices have a significant impact on health. By taking control of sugar consumption, individuals can reclaim vitality, prevent disease, and enjoy a more vibrant life.